So welcome to my 2026 Stat series. Yes, so because not everyone know me, probably maybe new people joined us, I'm going to introduce myself. My name is Sabina and I'm Senior Statistician with Women Health Research Institute. So if you have any questions, any project, you need consultation in statistics for any stage of the project from developing research question to publication, you can contact me with the request. So this year's session divided into two parts, one related to analytical framework and another one more like for statistical application. And I'm going to elaborate why I divided in two different stages. So today's lecture is from mess to meaning, what makes dataset analysis ready. So basically, I prepared a set of documents on our resource pages, and I think you received the notification that if you have time to review the documents, so know what I'm talking about it before the session. But if you didn't, it's not a problem because I'm going to discuss like in a lot of details what is in the documents. So if you want to contact me for any statistical consultations, you can go to our statistical resource page or statistical services page and submit a request or send me an email and I introduce you to the process. So why I divided it to two different parts of the lecture? What is VHRI analytical framework? So basically, framework includes set of relevant and related documents to standardize quantitative research and processes within the institute. And those documents are important because they kind of put all process and perspective and all the documents linked to each other. And those documents relate to everything from developing of research question to publication of abstract or paper. So last year, 4 documents were included. It's development of research question, why we write a study protocol, guidance for hypothesis testing framework, and publishing with purpose, how to write your paper. And for writing the paper, I actually share my experience because I personally can write paper in a week if I have analysis done and everything is ready. So it can be useful for those of you that never wrote a paper or did a couple of papers. So this was done previous year, and we have last lecture of the previous series in 2025 gives a wide overview of what inside those documents. So this year I added additional set of documents for our analytical framework, and those are documents related to data governance, design of research databases, and basically some devices of how process and clean the data. And again, in terms of data cleaning and wrangling and all this is from my personal experience, and this is a system I use on a daily basis for all your data sets that come to me for any statistical analysis or consultation. So why it's important to have VHRI analytical framework about data? Because for research, and it's very important to have solid and reproducible results. Yes, and if different teams or different students or VHRI members use the same structure or use the same principle on daily basis and learn how to do it, we as an institute and as research organization, we have better practice and better results and more solid communication of our knowledge and our findings. So those documents kind of related. The first documents, first set of documents and more on like research sides, how you think as a researcher, how you develop question, how you write the protocol for your study, how you connect between your proposal to hypothesis you want to test and to writing of the paper. This is kind of you behind the scene documents. Basically, it's how you collect information, what data governance and management principles you can use for your project, is small or large, and how to see the data and what to do with the data. So now, for those of you that don't know about it, we have statistical resource page. So statistical research page has all the lecture from previous years, like from Lunch and Learn or Summer Scholar or my Stat series recorded on our YouTube channel. And here's like summary of what we already have. So if you have a specific question, like if you have question about study design or which test to use for your analysis, or some basic modeling like linear logistic regression or basic survival analysis, you are welcome to go and listen to those lectures. And I think like if you come to me with project with survival analysis, it will be very helpful that you listen to this lectures, why they exist. So you come to me and you actually understand what we're talking about. So additional resources, there are some newsletters I did for eBlast for previous years. So basically, how I did it, if someone had a question to me, a specific question, and I answer the question, I usually pack it as a newsletter or like small report or documentation, and we post it on the website so other people can benefit from it. So what will be this year? First lecture will be about the documents. The second lecture will be who counts, denominators, bias, and illusion of equity. So I will tell what, in my opinion, is equity in data analytics. So because it will be different, slightly different from equity in research and development research question, because like how it's more related like to understanding what we're calculating and what is our study design. And the third lecture will be kind of in a reading club style, where I'm going to talk about interruption time series and forecasting using ARIMA model. And this will be on 2 papers we published on COVID-19 with Dr. Bidawi team. Those are already published. I'm not going to use actual data, but I'm going to use some outputs from the data processing without any personal information to show how this analysis should be done. Yeah, someone put in the chat that like link to resources. The resource link was put in all the advertisement on social media, but we ensure that everyone that sign up for the lectures will get all the information related to the lecture as links after the session. So what coming up right now? I talked about it a lot, but fortunately I have too many projects and don't have a lot of time to concentrate on it. But I'm working on Vichera GitHub page. So basically, I want to put series of pipelines, macros, and educational materials there. So if you want to do your analysis, you can download the like publicly used Dataset and all my programs in SAS and R and use it. It's also an educational tool because I create the outputs from my analysis, and you will be able to like learn how to describe your data and what each output means and stuff like this. So I really hope to have some like basic procedures done until the end of the year. And of course, as people ask questions, more newsletters and social media posts from me will be popping up on new channels if you follow VHRI. Oops. So basically now let's go back to the current lecture. So we'll have enough time. So basically, C2N data documentation I created with standard size analytical framework, and I will be talking like philosophically about transparency, decision making, and reproducibility of our results. We review the data. I explain what documents included and highlight how those can be used. And I explain the difference between data governance and data management. They are related, but they are different. And if we asked to listen to data cycle lecture before this one, so basically this is not new concept, and I didn't come up with it, but I using it a lot as a key framework for everything I do. So the way myself I write data governance and data management documents when I need it, it's in relation to full data circle or project circle, and I'm going to explain it how I relate each part of the documentation to full data cycle. So this is basically the screenshot of the documents we see. So first document is data principles and governance. A second document is the design and research databases structure, documentation and governance, and data cleaning and procedures. So you can see like a description of like beginning what the documents are about. I'm not going to go back to it. Why data principles matter? And everyone that listened to my lecture before know I like philosophy and all other things related. So I'm going to do some background why, in my opinion, it's important. So the expectation in the research is straightforward. We ask some questions, we have some conditions, we test some hypotheses, we get some results, and we share results with our research community, patients, policy makers, and everyone else to make the impact. But the issue with everything we do is scientific responsibility in data integrity and reproducibility of our results. For example, I did a small search on internet, like for happened and look for papers, and I was not surprisingly, but I was surprised to learn, for example, from the well-known paper from 2015, and I can send the links of the papers later to you if you want to read it. About 50% of every publication related to psychology people could not reproduce the results. Like it's solid paper, it's published, but the results are not reproducible. It can happen to I think if we read about any other area of research, like biomedical or health research or whatever we do, the results probably will be similar. Not every paper that published, someone else can have similar data and get exactly the same results. And the reason can be the data, maybe data or population, something different. For example, one research was done in developed country and the other one in developing country, like population different, population characteristics are different. But if populations are kind of the same, theoretically we should get the same results. And unfortunately, in most of the cases, we don't. And there's another paper that I really liked. It's for PLOS One. It's called Why Most Published Research Findings Are False. And it's given the reasons why. And it says like, there is a bias, our personal bias or data bias. Sometimes it's low statistical power. Sometimes if how flexible we do analysis or not necessarily we using the right model. And just because of those inconsistent things that the people do, we will get the data will be similar, the population will be similar, but results will be sometimes completely opposite. So why I'm talking about it is why I think the standardization is very important. Yes, we still can be in situation where results will be different, and maybe it's good for the discussion or for rigorous research. But I think the additional thing is very important for us as researchers to reduce the bias, the unnecessary bias. There always will be bias that coming from our population, our sampling, our modeling and statistics. But we need to reduce the bias of errors in the data on decisions that we make. And I think this is why the documents I put under a VHRI analytical framework, both for research and data, I think we all follow the rules and think of what we're doing and will do rigorous job, we'll probably produce more research papers that are good, contributing to statistical community, contributing to research community, of course, contributing to our patient community, because this is our goal, to improve life of people around you, of our patient. And it's maybe will help us to reduce the unnecessary bias and get the best results possible, or at least to try to do it. So we all know that modern data is very complex, yes? And if you attended our staff meeting, I talked something about complex system. Healthcare is a complex system, and data we use in healthcare is very complicated. We can design surveys, we can have we can review public patient charts, we have administrative data. Sometimes we do longitudinal analysis within different time points, or we're doing study design for multiple sites that not necessarily work in the same way. And usually when you do research, like we build research on the same data sources, we have multiple research questions to answer. And in order to work with all this, because it's a lot of information, and in current age, there's a lot of free available data that people can use to design something or test. There is so much information, new methods coming in. So I think it's why to work in our area expertise, that's like complex modern health research, we must to have first standardization and some governance processes. So what I consider core data principles when I personally work with any data. It should be transparent which data we use, traceability. We need to track everything we do in the data process, what we decided to change, what outcomes we decided to derive, why we decided to derive outcomes in one way in another, how we clean the data, why we excluded some records, why we included some records, and so on. Of course, I'm coming back and you will hear from me a lot, reproducibility of our work, consistency. I think if each project or each researcher work with the data like the same way I do, but I have like 20 years of experience in the area, so I learned slowly to come to some consistencies in my process that I'm sharing with you. So it should be consistent. Each time you work on the project, you should work with it like theoretically in the same way. Of course, there was differences because of the nature of the project, but how you write the documents, how you clean the data, you should learn to work on it consistently. And of course, it's integrity and completeness. Yes, we want our research to be complete, good, and as we say, we need to do everything in a good way. So now I'm going to go exactly to the some terminology related to the documentation. So key terms, so we're going to talk document source about data management plan. So what is data management plan? It's a document outlining how data will be managed through research project. It covers data collection, method, storage, and so on. And data management plan within your project will help you to ensure integrity, reproducibility. It will align your data management with project goals and ethical standards. And it doesn't matter if you work on small project, for example, you work on the project related to on your thesis, or it's multinational projects, including hundreds of collaborators. The core principle of data management plan theoretically will be the same, just the other one will be a little bit longer probably. So what is data governance? Data governance is the higher end of analytical data framework, and it's more about policies, processes, and procedures. So basically, data governance oversees all the responsibility and ensures the data handled ethically. The data is safe, secure. It says who can access, what can access, why can access, and so on. So it's a security, privacy, who owns the data, how data is retained, retention of the data, how it's saved, when it's erased. And the data governance procedures also should be in compliance with institutional, legal, and regulatory requirements. For example, we work in healthcare. So a lot of us might do clinical trials, yeah? If you work in the area of clinical trials, there is a lot of regulatory requirements, and also requirements will change, depends on where you submit your drug proposal. FDA, European Union, or Health Canada will have all different requirements. So data governance that's working like as the top layer of understanding of data for your project or organization. And as I said, data governance includes in it data management in some parts. And for me, data governance is embedded through all data cycle and operates through data cycle. Yes, and I'm going to explain how we come up to this conclusion. So if you attended or listened to my lecture about data cycle, garbage in, garbage out, I had this picture. So basically, inside of the circle, you have data security and confidentiality. Because I think we need to understand in health research, yes, we work on this project and it's data related to our project, but it's not our data. This is our patient data. And how I treat it, if I say like, oh, if I don't want people access my personal information in a specific way, that it's maybe incorrect and can breach my privacy, I would never do it for others. So the data is not ours. The data is from our samples of patient. It's the data, we use the data under certain ethical consideration, but the data belongs to patient. It's why all data cycle, every step of data cycle we do, it's related to this quorum statement, I would say. So basically, data cycling include like planning, collection, assurance, preservation, discovery, analysis. So basically, everything we do with data through the cycle of our project or research project or thesis or whatever, it's all in here. And data cycle, the way it's structured, it's ensures structure across project or different projects because we treated the data life cycle in the same way. In preventing consistency, it's aligning our data with research objective. It supports use of the data and ensures data privacy. So here I kind of created a short framework. So what is data governance? It's rules, ethics, and access. What is data management plan? It's your operational plan, how you're going to implement data governance or in terms of specific project or specific task. What data management plan includes? It's collection, cleaning, quality control, and so on. What data management plan or any data should include? It should include data dictionary and metadata, structure, description of variable, coding procedures, everything, how data is related, and so on. And in the end, when we go through all the data procedures, we will come to analysis that is validly reproducible. So here are basically very complicated and long, like a busy slide, but I try to write each principle of data governance as is related to plan, to any like part of the data cycle. For example, plan, when we planning like our project and our data, we establish data management plan by defining ownership roles, ethical approvals, setting processes, accessing, control access, data classification. So basically we have our research question, we're planning our research question, but we're planning how we're going to obtain the data, and we need to think right away how it will be, data will be managed. Collect. A collection should be adhere to the study protocols or ethics. It should be compliant with the privacy regulatory compliance like PIPA, HIPAA, and so on. And it should tell us how the data will be consistently collected. Yes, we need to, in terms of data governance on the low, high end, we should ensure like all the framework of how our data will be collected. So, for example, description of the data, I talked about it. So it's develop a robust metadata, and your data governance on high level should tell you how your metadata will be saved, because there is different ways to work with metadata and save. For a small project, it can be like Excel sheet related to REDCap data, but if you work with multiple data sources, it will become much more complicated. For example, preserve, provide guidelines of secure storage, retention period, backup protocols, disaster recovery, and so on, because we want to help that nothing will happen. But I had experience when the data was destroyed and we need to figure out how to back it up, how to put it up from backup and how to restore it. So you need to think it in advance. Discovery, you need to develop framework to support discoverability of the data. And also here it comes like how you index in the access, right? Because some people can only see the results of your data, and some people cannot have access to private information. So in data governance, usually like which body the sources can be specified. So integration, you should establish rigorous protocols of how data will be linked, and also how data will be identified. And you need to ensure that appropriate data analysis will be used and shared. So here it's kind of a little bit more in detail. Data governance, it's usually like more like high-end policy document. But if we're working on the projects that go through project cycle or data cycle, all this, not as this specific way, but all those steps of the data cycle should be incorporated in your data governance processes. So now we're going to data management. So translate, basically you have your idea data governance, how everything works at high end, but now you need to translate it for actual workflow, how it's going to be implemented in the field, basically. So it's a access, quality, documentation, and data management plan. It's usually adaptable for project side. When data governance is mostly like on institutional level or lab level or like organizational level, data management, it's much more small, and it's related to specific project based on data governance principle. So, and why it's important, when you develop data management plan, you will know exactly how your data align with research question. It will ensure consistency in your data and compliance and reproducibility. Yeah. So what data management can include here, like what was collected, and it's driven by framework. What are your outcomes, exposures, confounders, how you organize your data by tables, and so on. It's you need to decide how the data will be collected, baseline, follow-up, event-based, continuous monitoring. You need to describe your data sources, what you use, patient charts, survey data, merging with administrative data, or you're using created or external registries. Collection method, if it's self-reported data, observer-rated, system extraction, passive monitoring, or hybrid approaches. So basically, you need to define your collection methods. You also need to define the roles and responsibilities. Research associate, PI, clinician, coordinators, who is data manager, who is analyst. You need to state all the people in your team to know like who manages the data and who is responsible for all. You need to use here you write standardization. So you write like how you're going to design your script, which software you're going to use. For example, if you do predictive model and you say like, oh, how are you going to do calibration? If the project related more like data science, so it's like how it will be trained, tested, what you're going to do, how you're going to validate. So you also need to specify data entry platform. For example, if it's survey on paper or your survey on mobile device, like how you data, on which platform your data will be collected. And all this together, it will, like if all this together, it's written in, will impact your quality, security, access control. You will be able to audit trails, backups. So if documentation and data management are created correctly, if something go wrong with your data, you always be able to go back and figure out what actually went wrong. So what is the governance versus management? So basically, data governance is rules and oversight, and management and implementation. And how it works together, basically governance defines what we're going to do, how we're going to do on high level. Data management plan, we define how we're going to treat your data. And both those documents, as kind I wrote, requires collaboration. So all those documents should be related. So basically, summary to this first document about data governance and data management. Life cycle provides structure, governance is embedded, data management plan bridge theory, what we want to do with how we're going to do it through data. And if you have proper documentation, later we can reproduce our results. So, and if data is trusted and collected correctly, according to specific rules, it will become our asset. So next step of the document is a document related to design and research database. And I work a lot with extracts of databases from RedCap, and I can tell you it's a nightmare. So it's why I decided to write a document, and document is very detailed. And in any of my documents, if you read, I give a lot of example, real life example, like what happened and how you can resolve it. And believe me, all those examples, it's from my own experience. So I saw something like this and I come up with this idea. So all this relevant. So the designing of research database documents is exactly the same. I actually have professional experience of designing information management system and programming database, like on both graphic user interface and behind the scene using different like SQL server, Oracle server, and so on. So I have a lot of experience in designing database. So I put these documents kind of with guidelines. If you're doing your own research and, for example, you want to design the RedCap database or any other platform database for your research, I would strongly recommend you to use this document because it gives like very, very detailed examples of tips, what you should or shouldn't do and why. So, and why I'm doing it, because I think if everyone I work with and all HRM members will design database approximately based on the same documentation or same idea, it will be faster for researchers or statisticians like me to do the analysis, because less data cleaning and recording and so on will be involved. And again, the guy is giving you guidelines for how to design structured analysis, ready research database. So minimum data manipulation is involved. Also, how to align your database with government's analytical plan, how to create database for longitudinal or cross-sectional studies, because there will be difference. And again, like it should be related to ethical compliance and traceability and reproducibility, because like if you created proper database and recorded information correctly, it will be better for your analysis. For example, if you miss something when in your database design and later like, oh, we didn't collect this information, oh, we collected this information correctly, so you're losing some information. So I think in terms of collecting data, the database design is the most important thing. And I call it, it's not necessarily the correct like term from programming, but I call it requirement gathering. So basically you need to think about what your database need to include before you go and program it. So this way, like you basically write on paper what you want from database to do, what variables you're going to create and so on. So it's structured and related to your research. So again, like I'm probably going over and over, it's help you to design structured analytical ready database. It's aligned with your study protocol. It applies standardization and rational structure. You will have implementation of documentation and metadata, and it will ensure data quality and data governance compliance. They all go together. So here I put like how include exposures, outcomes, confounders. So when you thinking about your database, you probably already had research question in mind and what you want to do. So you need to see from the information you collect, and you need to decide what is your exposure, what is your outcome, what is your confounders, what your covariates, how you're going to collect your data. Are you collecting data in one point or multiple points? Clarity and simplicity. So for example, if you do data, you have like each row equal one observation, in each column one variable. If you have multiple visits, theoretically each visit should have its own tables that you put later together. If you have multiple time points, the variable names in each time point should be exactly the same. You should derive consistent coding and formatting. For example, if your answer is don't know, like for example, I code don't know as 98, unless it's like continuous variables that it will be missing, yes? So you define consistent coding, and it cannot be that in one question not applicable coded in 97 and another question not applicable coded in 98. It's confusing. You need to think of standards, how you will be coding your variables, what units you're going to use. For example, it's classic for survey. If you're doing weight and height in inches, in kilograms, you need to set like boundaries for those questions, so not to enter invalid information. But in the end, you need to know how to convert it for one time scale. Also, if you include in something with a unit, I suggest to have one column with values and another time column will say which units. Yes, because we want to use numeric data for the analysis, but if it's one row says 1 meter and another row says 25 inches, and you have and you have numbers and strings and everything in one, it will take you like, even like I know how SAS, for example, work with strings are probably the same. To separate it, to convert it, to figure it out, it will take you a lot of time. So if you do it like separately each time, so it will save you a lot of time because your data will be almost ready. You just need to decide which unit you want and how you're going to convert to unit. Each table should have unique participant ID or any unique ID. For example, if it's longitudinal data, unique ID will be combination of study ID and survey number or visit number. You need to have like one row will be one visited an event, but one row is associated with one unique ID. And I strongly suggest you, like there's more sophisticated database structures, but for what we do, 99.9% of what we do, use rational structure of database. And what I mean by rational, an additional slide, I go in it in a bit more details. You need to divide your tables logically. It's unassumable and it's wrong to include all your information you have in one table. For example, you have different people with their HIV viral load, yes, and you measure in such HIV viral load from lab test data every week. Imagine how much space it's going to take if for each row of this one you will put sex, age, and everything. So you have 25 rows of HIV viral load, and you attach the same information from baseline to this one. It takes a lot of resources out of network. It takes off a lot of resources on everything else. So you need to think how you divide. So basically, before you design a database, create a flow chart of rational database, how you're going to divide this information in segments or specific tables. So here it's in from my previous lecture about data cycles. This is basically how rational database looks like. You have independent tables that's related to each other and that can be linked with different unique identifiers. For example, if you have baseline information, your unique ID will be unique ID of participant. But if you would like to link it to data information with viral load, you will be able to link it by unique ID. But if you have like some tests taken from participant on each visit to put all your lab tests or all your information for each visit together, you will use probably like ID and survey together. So, and it's very important when you design a database, decide how the information going to be saved. I know in REDCap maybe like if you have one survey to program it in different databases, it's hard. It probably will be one table because it's easy to do and you ask in survey only one time. But if you design in database for multiple follow-ups, you need to think how to, or for example, it's not real life data like survey. People go online, click the link and answer the question. But if this data coming from like different data sources that you want to include in your database, maybe you need to think how structure it according to rational database framework. It's also very important to version your data. Yes, like maintain structure, label data set, and like you need to ensure that you know when data was saved. For example, like I have database that I designed to trace and write the information about all my requests. So I do backup because I don't have like actual server to save data that it's automatically backed up. So for example, I back up my database last day of each month and save it in a specific place. So in case something crashed with my database on my computer, I can restore some of the information. So the way I save it, it's like version control. So I know exactly on which day I back up my database. You should, to have it, you should have also consistent naming convention, including like project meant version, date, and so on. So basically, it doesn't matter what you do and how you do it. Different people do it differently, and I don't want you to change it. But when we design in database and have multiple versions of your data, you need to have design convention, how it's going to be versioning and how you're going to distinguish between different data sources. What else is very important? It's metadata and documentation. I say the good data, it's well-documented data. That you have everything you do with data, everything you collected, how you design. I know it takes time, but like I document everything I do because 20 days later, I will not remember what I did. So you should have data dictionary. We don't do it, but you should have like in your plan, describe tables. What each table includes, what variables included, why, how you coded it. If you're coding something about your data, like in formats, like how dates are, like for example, in SAS, there is a real issue like this date manipulation, especially if dates are in different formats. You need to decide, for example, I use specific date format for all my data sets. When you give me the data, if it's not in format, I'll check it, I'll do it, and I do it in format I used to work, and all my databases will have same date format or time format, and it's very important. So you need to have data quality procedures, how you check the data, what you do. And it's part why it's included in database design, because you think about all those things before you design in the database to collect the information correctly. Like how you, when you enter in information, how your database will reflect or accept duplicates. You need to validate the logic. So you need to validate for survey skip logic. But you do all of this before you actually program the database. You need to be very clear how it's going to be programmed. And also when you do metadata, you need to explain how data will be archived, how it will be related to metadata, who can access which documents. Theoretically, you need to version your documents as well. And how your database that you design will going to follow the data management and data governance policies. So I know I went very fast about it because there is a lot of information, but truly in the document you have a lot of examples like what not to do, how to do it, how I suggested to do it. You can do it in your own way. And I think if it's consistent through all the tables in your database or through all your projects and you work in specific ways that it works for you, you can do whatever you want, but it should be standard from project to project, done in the same way and documented. So good structure enables quality data. Documentation ensures reproducibility. Standardization will reduce your errors. And planning of your database will help you to reuse. And here I don't mean to reuse the data. I also mean to reduce the database. If you work in a specific area of healthcare, probably all your project will be more or less related to similar procedures of data collection. So if you designed your first database the best way you can, later to design the next database will be much faster because you already did the job, you have all the documentation you thought through, so you only need to introduce minor specification and changes to your database design. So now my best part, it's data cleaning and preparation. And why I like it, I think if you clean the data, you don't need psychologists. For me, cleaning the data is the best way. It keeps me calm and make me think, and it's like it's very, for me it's very soothing and very cool. I like it, even if it's tedious in a lot of things. I like cleaning the data, but also why I like cleaning the data, because I established specific protocols of how I clean the data, so I don't have to like I will have surprises to see something in the data I will not expect to see. But because I work through specific process, it makes me easy to work on it and like more enjoyable. And whatever I talk about this document, it's basically from my personal experience, how I work about the data. In data cycle lectures, I talked about a little bit, but I decided to put it also in the documents that people can go read. So basically how I work, I have 4 types of data set. Raw that I received from you or from any data system like administrative data, cleaned. It's slightly modified raw data, like checking for outliers, flagging things, documented. It's more like quality control and data check. After that, I transform the clean data in the structure I need, and I create set of final data sets I use in the analysis. So this is it's kind of structured at very stepwise process, and I think the way I do it, it's usually aligned with the study protocol, study design, because in the minute you create these 4 types of data set, and you need to do different analysis. For example, if you work on large cohort and you have like a lot of data and you receive a lot of requests for your data, basically in the end, if you need to pull data requests, it's mix and match. You put specific variables in different data sets, put it together, done. You created the data set for someone else. And it's also helpful when you do your own analysis, I think, to structure it this way. So most important, I want to talk about privacy and data linkage. Where usually when you work on data, only specific people can access the identifiable information. But technically, when we use data in an analysis or share data with someone else, for example, you want to share your data with me so I can do the analysis, you need to share with me the identifiable data. So basically, like in database, like if you take REDCap database, like the IDs assigned by database, it will be index 1, 2, 3, 4, 5. So if I know in approximately the order of patient coming to a clinic, I probably will be able to identify them. Not that it's of interest of me or I'm going to do it, but theoretically it's considered identifiable information. So never use IDs produced by REDCap when you're sharing the data. You need to create some kind of random ID or additional ID to share the information. When you create the data set, assuming I received a data set with identifiable information, because based on ethics I allowed to do it, I need identifiable information for data linkage and so on. Make sure that identifiable information and not identifiable information is saved separately. And usually if it's identifiable information, depends of where I saved on or what I access. Like if anyone can access the same folder you work in, that it's usually not a good practice, but at least password protected identifiable information. Restricts access. If you have linkage files, you need to restrict access. Again, who accessing what? And you need to ensure that there is secure integration across your different databases. So for the identification, like so I know sometimes we use, for example, REDCap give us ID 1, 2, 3, 4, 5. We said, okay, we're doing plus 500, it's a new ID, but it's still identifiable information. So if you want to technically de-identify information, you need to pick up set of random numbers and merge them to your data set in a random way. So there is no any order to your random IDs, so no one can link it back to your actual identifiable ID. So next step is the practical data cleaning. When you receive the data, you need to validate structure and what included in your data set with a study protocol and data dictionary. You need to decide what formats, numeric, dates, units, what you're going to use. You need to look for missing outliers, duplicates, and you need to check, for example, if it's your survey and you're doing frequencies or counts, you need to ensure that your data align with the skip logic for your survey instruments and so on to ensure consistency. Transformation for analysis. So you remember I said like you will have like raw data, raw clean data when you identify outliers and you went like back to patient charts to update the information or you flag it. Reshape data, it's basically going from wide to long and long to wide. So it's different structures of the data set and depends on the analysis you want to do, you would need to reshape it. So what else include in transformation for analysis? It's creating outcomes of variables. For example, in the data you have gestational age, but you need to identify variable like preterm birth, yes? Here you need to define definition and create the variable and validate. What I mean for validate, if you create in preterm birth based on gestational age, you must have frequency of preterm birth against gestational age to make sure you coded it correctly. Yes, we know what we coding, but how often you want to write equal type equals 0 in code and accidentally type equal 1. Yes, so you in the minute you create your outcome, you need to cross-reference what you created with a additional variable or variables that you used to create this outcome to ensure that your programming logic is correct. It's very important, and I know a lot of people don't do it, and you must do it. And I learned it myself in a very hard way. So everything you do with data sets, maintain intermediate data sets. And what I mean, like when we work in R or in other software, we create different temporary data sets. I think R save it inside your project. SAS not. SAS in the minute you get out, all temporary data sets are destroyed. But your project will not necessarily keep everything. For example, I think in R happened to me if you change the access to network drive. If you remap network drive and something changed, you might not be able to load all the data sets. So if you have an important data set that you might reuse, please save it as a permanent data set, not something you keep in the project or part of the project. Yes, like for example, I have projects when I have like 50 different data steps and creating different data steps till I get to the final one. But in each state, this final data set is created in permanent data set. Why? Because if you find an error or you need to reuse it, you don't need to rerun all your program to get to this temporary data set that might change for some specific reason. So, and in the end, for final data set, develop standardized master data sets. What I mean, so for example, if you work, it's more related to not small project, but for cohorts. If you define same variables 25 times and you need to give it to someone else 25 times, create it once, save it in final master data set and use the same. And why I'm saying it's actually very important for reproducing your results. For example, you have 2 students or 2 researchers using the same data set. You can have situations that you do frequency for preterm birth and you have different frequencies. Why? Because one accidentally or intentionally include missing values as the lowest or highest category, and another researcher created as a missing data. Yes, you use exactly the same data set, exactly the same original variable, but your frequencies are the same. Now you use this variable in a related analysis. Your results are a bit different and no one will know how to reproduce it. Yes, so I think like for larger projects, so even for your thesis, and the minute you decide to derive anything specific, you derive this variable and you save it in final master file. You lock it and you don't change it unless you decide. And for example, if I decided to use preterm births like less than 37 weeks and more than 37 weeks, or next time I decided to create 5 different categories, you keep all different variables in your master file because you may decide to use different one. For example, an example from transplantation. In kidney transplantation, we have delayed graft function. It means when kidney transplanted, it's not working right away and the patient might need dialysis. Based on the literature, I think there are 8 different definitions on delayed graft function that might be used. And truly, depending on your research and study design, you might decide to use different delayed graft function variable. You just need to specify it. So for example, if when I created file for delayed graft function in my previous job, I have all possible definitions I could find in literature in this data set. Why? I created it once, I validated it. Now it depends on the analysis I do. I can decide to pick up the one I use and it will be standard, that will never change. And here also, even when you have 2 students, they created variable differently, you have a problem. But even, for example, you created a new variable and you made a mistake and 3 different students use it in mistake. Yes, like we all human, we make mistake, but at least the results will be comparable even with mistakes because you have outcome with the same mistakes in all 3 papers. At least it's something consistent and reproducible. It's much better than having like 5 different papers with same variable that for some reason give you different results. So here I give a small example how to densify this data. This is the algorithm I use, so you can read, it's included in the document. So I create a file of random IDs and I ordered them. You can see the numbers here kind of in order, yes? Like, so I created like millions different random IDs. So after that, I have actual ID in the second table. So it's like 101, 2022 in order. But you see here, the actual IDs are not in order. Why? Because I assigned random number, for example, between 1 and 0, 0 and 1, and I sorted them according to this random number. So my actual IDs now are different. And after that, I match those IDs by the order. So technically, if you take 100, 222 and assign them to random IDs, those are not necessarily in order. Yes, like, yes, there is order in the numbers, but there is no way to trace for your random ID to actual ID easily. And here I put the diagram how it's done. So you have random IDs. You have your unique data set, and here it's very important. You must to keep your master person file with actual ID and random ID safe if you want to use same identification file for everything. Because I worked on the projects where random ID was the link file was accidentally deleted, and later we need to come up with probabilistic kind of match algorithm to match some of the data. So keep it safe. So what you do, you have your framework as a set of raw data, clean data, transformed analytical file. Those files will come with actual ID extracted from your database or somewhere else. Each of those data sets should be matched to your link file and actual ID is removed. And this way you can link the data sets inside your projects. But if you have like other sources, for example, you have your patient PGN and you decided to link it for administrative data, you link it by PGN, but your random ID will still be in the file. So all your data sources will be identified in the same way. So here I just to show you better, this is basically or at least the diagram of how the identification can look like. So what I wanted to say here, well documented, validated workflow, ensures transparency, reproducibility, and trust in results. So if you work from raw data to final analytical data, you can trace what you did in any step, and you save your data set in any step. And in the end, depending on analysis you do, you can basically mix and match your data set any way you want. You need to maintain continuous documentation, and you need, in addition to data dictionary, you should write like what decision you made on data cleaning, why you cleaned it in the same way, how you decided to transform your data set, why you decided to transform it in a specific way, and how you're going to do any data set linkage. You need to apply privacy preprocessing as I described, not to add 500 or 700 to your actual ID because it's not random ID and it's easily identifiable. You must to perform systematic validation check on structure, consistency, mergers, and logical relationship. For example, you merge into data sets. Look like all the IDs should be there. You merge to data set and sometimes merge of the data sets can give you duplicates that you are not expecting. Or sometimes you merge it incorrectly and you miss some information or some additional information that you need to can be added to the data set. Every time you merge or use SQL or whatever you use to merge to data sets, you need to check what you did and if it's exactly what you intended, because we all make mistake. We say, oh, we think that both files have unique IDs. So basically we think one-to-one match. But maybe there was an error and now it's not one-to-one match. So you have one same person twice in your data set that you don't need. So every time you do any manipulation with your data or do something with your data, you must to check that whatever you did is exactly what you intended to do. You must to track all changes through the versioning and maintain intermediate data set. And from versioning, for example, I received the data set for analysis, I checked it, I identify issues that I send to PI or the researcher, and I save the final analytical file. In several days, someone sent me an email and say, "Oh, Sabina, we reviewed your question and there were error introduced in one variable, and now we submitting you a new data, cumulative data set for analysis." Yes, I run this exactly the same data cleaning protocol through the new data set. And I'm creating the final or intermediate analytical data set. I will save it, for example, this data set with a different date. So I know the first one is from one. Why? Because if a researcher said, "Sabina, oh, this is a new data set, you can use it now," I still must to validate it against previous one. Why? Because if in previous one I did not identify any issues, and now if you send me a new data set and someone accidentally deleted number, or someone accidentally added something like extra row, whatever, I still need to be compare old version of this data set and new version of the data set and ensure that those data sets are correct. Or if you have situation, for example, if you extracting data from the same database each month is cumulative. So I cleaned all the data set from 2025, and now I added 25 and 26. What I do, I create data for 25, 26. I compare it to the 26 data. There is a way to compare, like in SAS, it's simple from compare. Probably there is something similar in other softwares. Why? I want to ensure that whatever data I have before for 25 match the current data because it's cumulative data. And if it's not, there can be two reasons. The previous year data is updated, assuming in administrative data some additional information was added, or there is an error in new data, or maybe there was error in new data. So every mismatch in my two data set, I need to document and I need to resolve. I cannot say, "Oh, I get cumulative data, I do the same data set at additional year and it will be fine." No, you need to validate everything. So and when you do it, like my documentation can be in binders. Why? Like everything I do, I write in a report or document. Any decision I make, why? Because it can be, for example, that someone used my data set that is publicly available to run different analysis and can get some results, and it happened to me. They can contact you and say, "Oh, we didn't receive your results," or something else, because maybe they made different decisions. So if I have all the decisions documented, I know exactly what happened. So basically, this is like summary of data cleaning and data processes and transparency. So why I think this like frameworks, those three documents are important? Because high quality research depends on structure, governed and well documented data. Data governance will provide us a framework for ethical, secure, and compliant use of data. Data management, like data management plan, will translate it in a practical workflow. Database design ensures that whatever we design is aligned with our research question, the protocol. And if we design our database with thoughts and in advance and like documenting everything, every decision we make, so data will be collected consistently. You will be able to trace everything back. You will know what names you did, what relationship between database are, and so on. If you use, you not necessarily need to use the data flow I use, but if you have like some preferences and for your specific project, you develop some other data preparation on statistician flow, you need to think about it and you need to use it in the same way over and over again. So there is no any differentiation between your processes and different data sets for same or different project. You must have continuous documentation and you need to validate everything. You need to check everything. You need to try to standardize everything. So then we have probably a good and reliable results for our research. So this is basically what I wanted to say. This is the last slide. I know that there is a lot of information, and I try to cover like all the documents in 1 hour, but you are welcome to read all the documents. And if you have questions, you can contact me, and you also can send me a question, or if you're designing new database or you're developing data management plan, please come to me in advance before it's too late. So it's better to spend more time when you're doing something in advance than after that have an errors and figure out what to do. Yes, so thank you. Any questions for now?
Hi, Sabina. Can you hear me?
Yes.
I am taking a walk, so let me know if you cannot hear me. Okay, thank you so much. It was great. I really love that you are actually informing the foundation of proper statistical analysis. But I have a question for you. So let's say that we have the same data, the same population, the same statistical practice. So technically, this should yield the same result, okay, or reproducibility. But let's say that, okay, it hasn't produced the same result. I'm just curious to know where would be, in this case, where would be your starting point to investigate and identify the source of difference or variation? Would it be like the data itself? Would it be the statistical practice? Where would be your starting point? Yep.
Yeah. So here, I had it written in one of the slides in my notes. Let me go back. So basically, I wrote it somewhere and I didn't talk about it. So, I look to everything in terms of philosophy, yes? So our bias can be there can be difference in actual results and also can be difference in our interpretation of the results. For example, you and I, we know we came from 2 different countries. The way we interpret results can be different based on our cultural background. And I talked about it in my second lunch and learn lecture, I think, about what is it about? What is statistic probability and uncertainty. We all know that there are different types of uncertainty. Some uncertainty is based on our perception, our data. There's a sampling error. There can be the way we created the model. So what I do personally first, I validate the data. Yes, because from my experience, most of inconsistencies are coming from something we didn't notice in the data. So I go back to the data, I'll check everything. Also, for example, where you have difference in results, if I use SAS and you use R, our results will be very close but different. Why? Because automatically R and SAS are using different options. For example, I know for sure for survival analysis for ties, I think SAS give Breslov ties and R automatically give you completely different form of ties, and don't remember the name of statistician. But your results will be different just because you use 2 different data sources with 2 different data options. Also, the way you run your model can be different. Even you run the same, you run logistic regression and I run logistic regression. The results can be different still, not by the options. For example, we use different reference categories or something else. Yes, so I will always start with the data and I always go to the documentation to understand that I understood everything in the data. After that, I go to statistical rigor, and after that, to validation of procedures, statistical procedures, how it was done. And I'll go through reading if actually, because sometimes you can explain difference in results and you should get difference, but if you can explain it, you are fine. Yes, you say, oh, we received different because Sabina imputed missing values and I decided to exclude missing values. Yeah, it's both legitimate kind of decisions, but decision may be different. Yes, so, but in 95% of the cases, it will be your data, even if you think the data is the same. I hope I answered your questions. Any other?
Thanks, Sabina. Are you going to talk also? I have one more question and I will just finish. Are you also going to talk about trust between, in other sessions, trust between the research team and the statisticians and the dynamic? Because that would be also extremely interesting for me to learn about that.
This is a very hard question because I will share some personal. 95% of my time working with different research teams, I'm not explaining the results. I need to justify why I did something and why I did this model and not another. Yes, I know probably most of the people even don't understand what I talk about, but is justification. So my opinion, if you work on this, you need to trust each other and you need to respect each other. Yes, so I think in this condition you will work successfully. I think we have data, we have this framework of research, but I think everything comes to people. Yes, if you know each other, if you trust each other, and we can, as a team, we can openly talk about each other with each other, it will be good. For example, I can make mistake in the analysis and you can see that I made mistake. You can come and ask why. Either we found mistake or I explain you why it's not mistake. Yes, but I think the most important for me, statistician, working for different team, it's that you trust me as an expert and I trust you as an expert as well. Because I think if you put statistical expertise, clinical expertise, and all our knowledge, accumulated knowledge together, we probably will have the best product we can have. Limiting to limitation in data and everything else. Is there any other questions? So if there is not any other questions, we're going to finish here. So the next lecture will be on next Thursday on April 23rd. So if you didn't sign up, please sign up.